We always hear that most men getting older get prostate issues, benign hypertrophy, cancer while getting older. So, is there anything men can do for their prostate health? Supplements, certain exercises, avoiding some things I don't know, and at what age should they start doing that? So, Jordan.
The lifting dermatologist, Stephen DeVos,
Steven
and
Voss.
he's got a ton of great stuff.
A Belgian doctor with 30 years of weightlifting experience and the author of Flexibel Dieet en Krachttraining.
Please like and subscribe.
And that's something that's a great, it kind of opens a can of worms because we have to always define what's an actual prostate issue and what's not. A lot of guys assume a certain symptom is from their prostate, when in fact it may be their bladder, it may be their pelvic floor muscles. And I see this a lot in younger guys, especially if they're stressed, they work a stressful job, or there's a lot of turmoil in their life. They can get this kind of, they used to call it chronic prostatitis, but it's really kind of a chronic pelvic pain syndrome that has more to do with their pelvic musculature, and it can cause symptoms of prostatism essentially, but the treatment is totally different. And so for those guys, I mean, obviously stress relief. I've seen TRT. There are a few studies showing testosterone replacement may help with that. I mean, it just makes sense because it helps everything, right? It may just help you stress less. It may be some anti-inflammatory effect from testosterone. I have tried daily Cialis in a lot of these guys just to help with improved pelvic blood flow. I've seen it help a lot of them. Now, whether it's placebo effect or not, I don't know. It doesn't matter. I mean, tadalafil is safe and effective for other things too. It's effective for BPH issues. So that's something there. I mean, you don't want to just jump to a drug though. You want to do lifestyle modification, and that's for any health issue, not just prostate health. And that's what I think the main thing we have to realize is people want to jump to a pill or a supplement. You only need a supplement if you're deficient in something. I mean, in my opinion, you want to try to get everything through healthy diet, raw foods and all that. And then if you still need something, you take it. Anything specific for prostate health, it's just the data is not clear on that. I know a lot of guys take saw palmetto. I'm not going to recommend anything that blocks DHT conversion even a little bit because I don't think DHT is the factor. But I think a definite issue in a lot of younger guys is stress, and it really is. There are guys that have anatomic defects. They have a high, tight bladder neck, and so that's a lot of times a surgical thing. That's not a big prostate. It's just like a median bar or a tight ring where their bladder opens and it just doesn't relax. You can try Flomax for that, but a lot of times they'll need a incision of the prostate there just to open that up a little bit. I still need to just dig in more. I mean, we don't know why some of these guys grow these massive prostates, right? But not all guys with big prostates get symptoms. So it's more than just the size. It's the shape. It's the configuration. Is it compressing the urethra? Is there a ball valve effect in the bladder? What I have noticed, and I just haven't read enough on this recently, not in a few years, to see if anything's new, is, risk factors for this. But I do see guys with these big prostates have comorbidities and usually some type of vascular disease or endothelial dysfunction. Almost all these guys have had a prior heart attack. They got stents in. Tons of these guys are on blood thinners. They are diabetic. And I think that has a lot to do with it, whether there's some kind of ischemia going on to the actual prostate that's then causing some kind of hyperplasia to go on. I don't think it's just hormonal. I don't, because like I said, they've done studies on these guys with big and small prostates, and the intraprostatic levels just aren't really any different. So what you can do for your own health is be healthy. It really is. There's some guys that just probably, genetically, you're going to grow a median lobe, you're going to grow a certain configuration that may become an anatomical issue. And in my opinion, I mean, that becomes a surgical issue, right? There's no, especially if you got a big ball valving median lobe flopping over your bladder neck every time you urinate, there's no medicine in the world that's going to fix that. That's a purely plumbing issue. And if you go in there and open that up, I mean, it fixes it. I mean, there's risks and side effects to surgery for sure. But the best thing you can do is be as healthy as you possibly can. Don't stress. Don't worry that your testosterone is going to cause these issues. There's a good paper, and I posted it before, that for lower urinary tract symptoms in general, testosterone replacement therapy seems to help with that, whatever the cause, whether it's prostatism, pelvic floor syndrome, or even overactive bladder type symptoms. I've had anecdotal reports on guys in the forum discuss when they get on aromatase inhibitors, which we are against, that they develop more urinary complaints. They develop more urgency and frequency of urination, getting up at night. It's really interesting. And it's probably has to do with the lack of estrogen, which is, helps dilate the blood vessels, improves blood flow and all that. So, it's be as healthy as you can. Don't just jump always to medicines. I don't think there's any special supplements that are going to necessarily improve it, but if you're deficient in something, then figure out what that is. And then for the younger guys who have a lot of symptoms of the prostate, don't just let your doctor keep telling you have prostatitis and throw you on Cipro for 60 days, because it's not going to help. I mean, if you got a documented actual infection, fine, but most of these guys do not. And they need, if stress relief doesn't work, they may need pelvic floor physical therapy. And it's just been life-changing for a lot of these guys that I've had. They've just got these chronic tight muscles. They have pain with ejaculation, kind of these random symptoms. They'll get pain in their lower back and their inner thighs and the prostate area. And if they get a good pelvic floor therapist who can either work those muscles out on, like an active release technique, or teach them to do exercises, after a few months, they feel a lot better. So that's important for a lot of guys. And there's several guys in the group that have had this and have kind of given their testimony on that.
Okay. At what age should men start getting their prostate checked?
So according to our guidance, changes every couple of years. Last time I checked, 55 years old now in the United States for guys who don't have risk factors. So that's kind of but you can start before that. It's just those are sort of the guidelines, right? 55 to 70, anything before and after is a shared decision making between you and your doctor. I don't think it's a bad idea to start at 50. I think guys who've had a strong family history, African Americans are higher risk prostate cancer. They'll usually start them in their late 40s a lot of times. Or if there's, strong family history. I mean, if you've had a brother and an uncle and a dad all had prostate cancer, you may want to start at 40. We're trying to avoid overdiagnosing prostate cancer now, but on the flip side, you don't want to be that guy that ends up with a really high risk aggressive prostate cancer. And so it's kind of it's a tricky thing. Because you don't want to wait till you have symptoms of prostate cancer, because then it's, too late, right? If it's already cancer and they're blocking your urinary tract, that's not good. I think we had a guy, the youngest I've seen, and others younger, but that I've seen personally, was 38 years old when I was in residency, had to have a prostatectomy and just randomly had a PSA done, So there's that balance between, they always push us to screen less because we overdiagnose, and that can be true. We need better screening tools. We get MRI now, we've got 4K scores and all this stuff, but they're still not honestly, one of the best things is a rectal exam. Really, if you're gonna, especially for something that's aggressive or something that's worrisome, if you feel a nodule that's rock hard, or entire prostate feels like concrete, or something's just really asymmetric, you want to work that up. And even MRIs are not foolproof. They usually will catch a high-grade prostate cancer, not always, but they can miss, subclinical, prostate cancers. So we just need better screening tools, and that's a problem in cancer screening in general. There's a lot of people that end up with either overdiagnosis or overtreatment. There's a lot of women that were hurt from getting total mastectomies and lumpectomies, and didn't, cancer they had may not have ever killed them, but it's a tricky thing to figure that out. We don't have an 8-ball. And so, but yeah, as far as the age for screening, I still try to follow the guidelines, but if a guy comes in and he's 50 and he wants this prostate check, yeah, absolutely. That's his right to do that. I'm not going to say, no, you got to wait till you're 55.
Thank you so much, Jordan, for clarifying this. Thanks.
Absolutely.